Hi guys, in this video we're going to talk about gum disease and how it affects you. So gum disease is a term that we use to cover a range of conditions that affect the health of the gums. It goes from the inflammation of the gums, gingivitis, that most people heard about on the toothpaste commercials, all the way to periodontitis or the periodontal disease. And that's when you got a active infection and pus leaking out of your gums. So it's a very severe case, and it can eventually even lead to tooth loss. Now, it always amazes me how a lot of our patients, or new patients, will come in and they're completely unaware that they have gum disease. So it's only when we point it out to their patients that they suddenly realize that a little bit of bleeding when they brush their teeth, when they floss, or the little sore spot on the tooth, that funny taste, that their partners actually talked about. It's not just what they eat, but it's actually a sign that there's something worse going on in the mouth. So what I have here is a little diagram, and I'd like to talk a little bit about what exactly is gum disease, where it comes from, and what we as dentists can do to help you prevent and treat gum disease in your mouth. So I think it's important that people understand what gum disease really is and where it comes from, and what we as dentists, what we can do to help you treat it. So before we talk about gum disease, we should understand what healthy gums look like. So healthy gums look nice and pink, they're firm around the tooth, there's no swelling, and most importantly, there's no bleeding when you brush or floss. So a lot of our patients come in and they complain that the gums bleed a little bit when, say, they bite on an apple, or there's a little bit of a funny taste in the mouth. And often when we go and we assess their teeth, we find signs of what we call gingivitis. So gingivitis is the first stage of gum disease. A lot of people have it, don't even know. The problem with gingivitis is that it's totally pain-free. Very, very rarely we'll have someone who comes in complaining of tender gums and it's due to gingivitis. So number one, you notice your gums start to bleed. You bite on an apple, you floss, you brush your teeth, there's blood when you spit out. So that is a big, big warning sign that something is going on. Number two, you notice that your gums are just a little bit red or a little bit puffed up around the teeth. So the areas we need to be keeping an eye on are the areas where the tooth joins the gums. So when you come in for an assessment, or you come in for a checkup, coming for a clean, what we'll do is we will use an instrument called a dental probe. It's an instrument that we have, and we can actually measure the gap between your gums and your teeth. Now, this measurement is actually how we can be very, very sure of what's going on. So the deeper the pocket or the gap between your tooth and the gums, the more likely it is that you have gum disease, and we can then assess how severe the gum disease is. So these measurements that we take of your teeth actually allows us to diagnose what stage of gum disease you've got. So gingivitis, very shallow, only the top layer of the gums inflamed. We find that when the gum starts to let go of the tooth, we're starting to see more damage to the structures that hold the tooth in place. So we call that periodontitis or periodontal disease. So the early stages of periodontal disease is when the inflammation is actually just around the top area of the tooth, but we start to see one thing that is very important. And the one thing that we see is some bone loss. So it's the bone that holds the tooth in place in your mouth. And once that inflammation spreads to the gum and to the top layer of the bone, we see the bone start to shrink away. So if the bone continues to shrink away, we see more and more swelling. The pocket or the gap between your tooth and your gum starts to increase. And eventually, this can even lead to tooth loss. So if you lose enough bone around your tooth, eventually you can have a tooth that moves in the socket, a tooth that is sore when you chew on hard things, and eventually this is a tooth that needs to be removed. So of course this won't happen overnight, don't need to worry about it too much, but it always starts with that little bit of bleeding, the little bit of gingivitis, because you forgot to brush one day, or perhaps you're not flossing as often as you should. So it's important that you're always keeping your teeth nice and clean, not just to have a nice fresh breath, but that you can then prevent gum disease and periodontal disease. So if you're unsure about gum disease, and if you think that perhaps you might have a little bit of inflammation or even some mobility of your teeth, next step is just give us a call, book yourself in for an appointment, so we can actually go through this whole assessment with you. We can do a full mouth periodontal charting, so we can screen your teeth, screen your gums, and make sure that they're healthy or not. And then we can talk about treatment. So treatment, it goes from a simple clean all the way to full-on periodontal treatment over multiple visits. So the important thing is, the sooner we get to it, the better. Don't sit on it just because there's no pain. If you notice there's bleeding, if you notice funny taste in your mouth, anything at all, go and see a dentist as soon as you can, because the earlier you have treatment, the better long-term results will be. So if you have any questions, feel free to send us an email or give us a call. In the meantime, we've prepared an information sheet with a bit more detail and tips and tricks on how you can prevent gum disease and what you can do to start treating the condition straight away. So you'll find the link below, check it out, and share it around if you like it. So click the like button if you find this video useful. Don't forget to comment and subscribe.